Are we on now?
Yep.
I couldn't see live video. There we go.
Okay, so Trish has given the thumbs up.
Yeah.
We're on.
Okay, so I couldn't see on my screen here, but I'm sure Lisa will help me jotting down all the questions. So hi everyone, thank you for coming tonight on our Facebook Live event. I would like to take this opportunity to thank Trish and Christy to help me getting me to meet you guys online so that I can share my experience on breast implant revisional surgery. So just a little bit about myself to start with. I am Eddie Cheng. I'm a Facebook Live virgin. So if I appear to be very anxious, because I am. So just excuse if there's any blooper tonight. But I will try to answer as many questions as possible. So to start off with, seriously, I do like to introduce myself a little bit more. So I am a specialist plastic surgeon. I spent most of my training in Brisbane and Melbourne. But after I finished my training in Australia, I did go to Canada to do a cosmetic surgery fellowship. And when I come back 11 years ago, I set up my private practice at the Wesley here. So it's been 11 years now, and I have a great team of people helping me looking after my patients because I can't do it myself. So before I get into the nitty-gritty of the breast implant revisional surgery, I would like to show you all my team members so that you can familiar with their faces as well. So I might get Lisa to help me show you this photo. So this is our team. So obviously these are the people that make me look good. I have Stacy and Mahela that help me greeting the patients when you come into the front door, and Lawrence and Leah, they are both my patient coordinator. So they do help me answering a lot of patient questions before my patient even come in. And not to mention, after surgery, all my nurses help me to look after all my patients as well. Lou, Ainsley, oh, hi Jess, I can see you coming in. So Sue and Chelsea, they are all my nurses to help me looking after my patient after surgery. But also I have Robin, she's my practice manager, and Lisa's both my wife and also my practice director. So between Robin and Lisa, they help me to create my visions to looking after patients, and also try to help me to give my patient the best patient experience when they come into our clinic. So Lisa is here today helping me, and she's going to make sure that I answer all the questions and make sure we write down all the questions so that she can show it to me. So is everyone here?
I think we're good to go.
Yeah, so if everyone's good to go, I might start off with going through a bit of a basic about why we need to do implant revisional surgery to start with, and then I will then go on answering some questions that has come in overnight, and hopefully we'll have enough time to go through every single one of them. And also in the meantime, if you have any questions that you want to ask about breast implant surgery, then make sure that you send it in at the same time. So I think let's just go through the reason why we have to do breast implant revisional surgery. So with any breast implant, because they are man-made, they don't last forever. So on an average, about 10 to 15 years, we might have to replace them because they might lose the integrity of it. When we have an implant in the body do form a scar around the implants, what we call capsule. So this capsule sometimes can become firmer and make the breast unnaturally looking, and also feel firm, and in some situation also cause pain as well. So in that situation, you might have to remove the capsule and replace the implant. And after surgery, some people, no one chest wall are exactly the same, no one breasts are exactly the same. So sometimes after implant surgery, there might still be some asymmetry. But in certain situations, if the asymmetry is big enough, then we might have to revise the implant surgery to make them look better. Obviously, before surgery, we do like to make sure everyone select the right implant and the right size. But occasionally, some people do like to go bigger or smaller after the surgery. Then in that situation, we do then have to do another operation again. So that's the few reasons that why we do implant revisional surgery. So some of the questions that come in. So Lisa, I think...
Yeah, I've got a couple of questions here. Do you do reduction lift?
Yes, I certainly do reduction lift with or without breast implant. So depends on what patient need and what's the safety. Sometimes if we do implant surgery, I do want to make sure that if I combine a lift procedures, I will be able to do the reduction lift procedures safely and also to be able to give the patient the best outcome. So in some situation, the best option might be to do a lift and reduction first, get the platform right, and then put implants in afterwards to make it look better afterwards. And in that situation, I can then be ensured that they get the best result, and also it will be safer as well.
One of the questions we had was, what implants do you use?
Right. So implants, what implant do I use? I do use all the different implants. So depends, the reason why I use different implants is I figure that no one, everyone's, they want different appearance, and also no one person are the same. So with be able to use different kind of implants, then I can select different implants to suit certain patients to get the best outcome. So I do use round, smooth implants. In some situations, some people might be better off with the Motiva implants. Within the Motiva implants, it also have two different gel as well. Some people like the softer feel, more natural look with the Motiva. Then I use the Motiva ergonomic implant. But in some patients, they do like the firmer gel with the more roundness on the upper pole. Then the progressive gel Motiva implant will be best suited in that situations. And then in some situation, especially in reconstruction purpose, and people that really want that skis look more natural look breast, then I do use the teardrop shape implant to get the best outcome possible. So I think some of the questions that come in overnight. So this lady, she is 18 months after primary breast augmentation. She has Mentor 440cc anatomical implant, but she's concerning about the link with the texture implant and what we call breast implants associated lymphoma. So she's thinking about having her implant removed or replaced, or change it to a smooth surface implant. And the question is also, is it easy to switch from an anatomical shape implant to a round implant? So I think we need to take a step back and think about the safety of texture implants. So obviously recently there's a lot of media mentioning about the lymphoma associated with texture breast implant. So to date in Australia, there are only about 78 cases, so the number is still quite small. And because the number is so small, there's a lot of theory behind what caused the lymphoma. So at the moment, what we think causes it is the texturing implants in a patient that got the gene that make them more prone to lymphoma. And if there's any germs contaminating the surface of the implant during insertions, in that situation, it might stimulate the body to form more lymphatic cell and transforming that into lymphoma. So what happened is, with the texture implant, they also look at the statistic. They think that the rougher the texture, the more chance that you could cause lymphoma. So for mentor implant, the texture is not as rough. So in terms of risk, so in the worst situations at the moment, we are thinking about it is 1 in 60,000 chance that it might cause lymphoma. So the risk is still very small. So if you're happy with the shape of the implant, it's important to talk to your doctor at the moment about the safety side of things, because if we can do surgery again, but obviously every time we do surgery, there's also risk involved. However, if you decided that you want to change from the texture implant to a smooth surface implants or Motiva implants, so certainly it can be done and it's not that difficult. But actually, obviously, we need to make sure that when we swap the implants around, we want to find the best proportion of implant, the best size and the best dimension to suit your frame, so that we can get the look that you want to achieve as well. The next question is it true that bigger implants are more likely to have more problem, and will they need to be replaced sooner? So let's talk about bigger implant. So whether the implant is small or big, I think they both will last as long compared with each other. But the bigger implant do put a bit more stress on your breast tissue and also your skin. So in the long term, with a bigger implant, especially if it's on top of the muscle without enough muscle support, then it will drag the breast and make the breast look more saggy and also stretch the skin as well. So the bigger implant, in the long run, it could potentially cause more problem with the breast tissue, but it will last as long as a smaller implant. And then the next question is, does an implant replacement cost as much as the initial breast augmentations? I think overall, the cost of implant replacement surgery is a little bit dearer than primary breast augmentation, because usually the complexity for replacing the implants is a bit more than initial primary augmentations. So it depends on the complexity, obviously, in needing more time for surgery and also needing to replace the implant. So overall, the cost will be a little bit more than primary breast augmentation. So on the average, primary augmentations cost around 10,500 for revisional surgery, roughly around 15,000, inclusive of the hospital fees, surgeon's fees, anesthetist fees, and the implants as well. So talk about revisional surgery again. So the next question is it harder the second time around to have surgery done? And the second part of the question is, will I have a new scar or will the cut be made in the same place? And then there's a third part to that question. If they are made in the same spot, will they heal as well as the second time around? So let's answer the first part of the question first. So the second time around, the recovery in general depends on what we need to do to revise the breast implant. In a way, the muscle already stretched from the primary augmentations, so the muscle tightness is not going to be as much. But at the same time, if we doing a lot of removal of capsules, then recovery do take a little bit longer. But in some situations, if it's just a minor adjustment, then the recovery might not be as much as the initial breast augmentation surgery. In general, if I'm going in to do a revisional surgery, if the original scar allow me to do what I have to give the patient the best result, I would like to use the same scar, because obviously minimizing any scar would be better. However, in some situations, if the implants were originally inserted through the armpit, then to do the revisional surgery through the armpit would be very difficult to achieve a good clearance and a good outcome. Then in that situation, I would prefer to go under the breast to do the revisional surgery. But if I'm going to go through the same spot, I normally would remove the scar to start with so that you don't have double the scarring in the same location. So we'll cut out the original scar and go through the same location to do the surgery, and then close the wound nicely and neatly so that you only got one scar at the end of the revisional surgery. So there's a few questions already that we answered. So we got a lot more questions coming in as well. So the next questions that came in is, how can I know if I need a revisional or not? I don't have any sign, but I'm paranoid from all the stuff that I've read about them, and I had my implant in for 13 years. So it is a really good question, because a lot of the time, you know, with implants surgery, as I talked about before, at some stage we do have to replace them. My philosophy is, you know, if there's nothing wrong with it, obviously we don't want to replace the implant regularly. On the average, implants do last between 10 to 15 years. So at the 13 years mark, there's a chance that in the next few years, it might start losing its integrity. So at this point, you know, if you don't have any sign or symptoms to suggest anything going wrong, the best thing to do is to obviously see your original surgeon to get him to check your breast. And also, ultrasound scan is a good screening test and to look for any fluid around the implant or to check the integrity of the implant. However, it's not as accurate as MRI scan, but more cost effective. MRI scan is the gold standard in looking at breast implant to check the integrity, but a bit more costly. So I would recommend at the 13 years mark to get an ultrasound scan to have a look, and then after that, maybe every 2 years to get your implant checked as well. And the sooner we find out if there's any issues, then the sooner we can replace them for you before it causes any issues. So the next question is a very good question. So the next question is, if you have implant removed, do you always need a lift? I'm thinking of having my implant removed. I'm not sure if I want to replace them, but don't want saggy skin. So it is a very good question, because every time patient come in to see me about having their implant removed, everyone do worry about how the breast is going to look afterwards. So whether there's a three group of patients in these situations. So when I assess the patients, it is important to look at what their breasts look like before we remove the implants. If their breast is in a good position, the nipple sitting above the fold of the breast, then most likely after we remove the implant, we don't need to do a lift. However, in a second group, when the breast already quite saggy with the implants in and the nipples is not in the best positions, in that situations, we know that removing the implant, the breast is going to look deflated and saggy. And in that case, we would suggest lifting the breast at the same time if the patient want to, but depends on each person, because some people would be quite happy after many years to go back to have a more natural looking breast. So also depends on patient preference. And in the borderline situation where the nipple is not in too bad of a positions and the breast is mildly saggy, then in that case, we might take the implant out to see if the breast will retract itself. And if it does, it's good, then we don't have to do anything. However, obviously, if the breast is quite deflated and quite saggy, then we can always do a lift later on after the original explant surgery. One of the things also determine whether most likely you need a lift or not after surgery is your skin quality and also the consistency of your breast tissue. So if your breast tissue is quite soft and the skin is quite stretchy, most likely when we remove the implant, the skin is not going to retract back. So I do have a couple of cases of removing of implant with a lift or without a lift, I can show you some photo actually. Let me see whether I can bring that up to show you. So this is a lady that she had her implant in literally about almost 30 years ago. But 3 years ago, she had her implants removed and replaced up on the Sunshine Coast. And soon after, her right side developed infections and subsequently bleeding revisional surgery and capsular contracture developed about a year later. So as you can see, she got capsular contracture on the right side, and the left side, you know, she's not quite happy with the appearance of her breast implant either. And also, ever since it's the second time that she have this texture implant, she feel that she get quite a lot of itchiness and also rash on her body. So she had underwent a lot of extensive tests, and eventually she couldn't find anything wrong with her otherwise. So she decided that she would like to have the implant removed. So I removed both implants for her. As you can see, her nipple position was quite good, her skin quality was quite good. So by removing the implants, obviously it would be a little bit deflated after the surgery, but her breasts still sit above her fold and still look quite natural. And after the surgery, she was very happy with the outcome, and also her rash has disappeared so far. So it's been already about 8 months down the track, and she is quite happy without her implants and didn't think that she needed a lift. And let me show you a case that we remove the implants and then we lift the breast up as well. So let me show you this lady. So this lady, she has silicone implants in, this is her before photo. So she has silicone implants in under her muscles. They are round, smooth implants and around 220 cc implants. So the left breast implants has ruptures and causing capsular contracture. And she, at this stage, would prefer not to have any more implant. As you can see, before surgery, you can see that her implant is sitting quite high with her breast drop below her breast implants, and her nipple is in a lower positions. So she would like me to improve her breast shape at the same time during the removal surgery. So what I've done is I remove her implants with majority of her scar capsule and then lift both breasts up for her. So as you can see, this is about 4 months after surgery. The scar is still healing at the moment. Then her nipple is in a much better locations, and her breast sitting in a much better position and look more natural than having her implants in with the breast that fall over the top of the implant. So while you're on this subject, let me just show you this lady as well. So this is another patient that I removed the implant for. So this lady had her implant surgery done 13 years ago, and she have a 220 cc implant on her right breast and 240 cc implant on her left breast. As you could see, her left breast has a bigger implants, and also her breast on the left breast is much bigger. So obviously, after having 2 children, her breast somehow gradually increased in size. She feel that with the implants, she has a lot of heaviness around her neck, shoulder area, and have some discomfort associated with it. So what I have done is I removed both of her implants, and then I lifted her right breast and reduced her left breast to make it as balanced as possible. So this is her about 8 months after her surgery. So as you can see, without the implant, she's still got quite a lot of breast tissue of her own, and she's very happy with the fullness without the implant, and definitely has improved the discomfort around her neck and the shoulder area as well. Great. Yeah, so we have covered quite a fair bit of topics so far, and let's see whether we can try to answer more questions in the meantime.
One quick question was exactly what brand of implant do you use?
Right, so don't know whether you can hear what Lisa said. So the question is, what brand implant do I use? So I do use all different brand implant. Just like yesterday, I use Mentor, I use Motiva, I use Nego implant, and I use the teardrop shape, round shape implants as well. So I don't just use one brand implant or one size or shape implant. It would be depends on what that best suit the patient and what the patient feel comfortable with different implants options.
There was a question about warranty as well, so that can also dictate what you use.
Yeah, so the other question is about the warranty of different implants. So I do use Mentor, Motiva implants. They both have what we call lifetime warranty on ruptured. So during this lifetime, if the implants ruptured, the company will provide a set of implant for free for you to have it replaced. Obviously, you do have to find a surgeon to replace them for you, but they do have a lifetime warranty. With Mentor, they do have capsular contracture warranty as well. I might have to check with Lisa to see how many years do they have.
10.
So 10 years for capsular contracture for Mentor, and I think it's 7 years, 5 years for Motiva.
And does Medicare cover any portion of breast implant revision surgery?
Yeah, so the question is whether Medicare is going to cover any breast implant revisional surgery. So unfortunately, since the 1st of November last year, Medicare has changed their rebate ruling. So any implant that was put in for cosmetic reason, there won't be any more item number associated with replacing the implant. So if we want to replace the implants, unfortunately, if Medicare doesn't cover it, your health fund is not going to cover it. However, if the implant was put in for reconstruction purpose, for people that have breast cancer, or for people that have significant breast asymmetry or tuberous breast, then in that situations, the revisional surgery will still be covered by Medicare and partly covered by health fund as well. But if you decided to have the implants removed, there's still an item number to have the implants removed, regardless whether it's put in as a cosmetic reasons or a reconstructive reasons. So there's still an item number associated with it. So any other questions so far, Lisa?
I think you'll cover those.
Yeah, so let's keep going with the list of questions that we have. So the next question is, I'm definitely going to get my breast implant removed. I am a size 12D and had a 325cc implant since 2011. I'm wanting to have some fat transfer to replace my implants. It's worth doing, and because I heard that only a small percentage of fat transfer actually take. And what's your opinion on fat transfer after removing implants, and do you do it in your clinic? So I do fat transfer for certain purpose, especially to help to improve the appearance of my reconstruction and also breast augmentation. especially for people that have very thin skin. Fat is really good in terms of improving the coverage of the implants to minimize the rippling. Technically, certainly we can remove the implants and inject the fat into the breast to enhance the breast, but logistically it is not as simple, because you're right, each time when you put fat in, not 100% of the fat will take. So sometimes if we inject 100 mils in there, 50 mils might take, 75 mil might take. So because we want to do both breasts, then sometimes one breast might take up more fat than the other. And the other thing is we can't inject too much fat in one go either, because when we put in fat, it's rely on the circulations in the breast tissue to sustain the survival of the fat that we put in. So if we put in too much fat, then a lot of fat doesn't survive and could cause problem like what we call fat necrosis, and the breast could become lumpy. So theoretically it can be done, but logistically we've got to do it very carefully. We can't put too much fat in one go, so you might need multiple surgery to achieve a certain size that you want. And also there's some complication like lumpiness that could be a problem, and also asymmetry obviously. So logistically it's a little bit difficult to getting the result that you want. And the other thing about fat injection is fat is quite soft, so obviously the appearance of a fat injected breast will be more natural compared with the implant. Sometimes obviously most implants that we put in will still look natural, but at the same time you want that full firm breast appearance after breast augmentation. Fat would not be able to give you that sort of appearance. So then the next question is about recovery after breast augmentation, breast revisional surgery, and also is it possible to remove one size and replace it with a smaller implant, and whether if we do that, whether we need a lift or not. So the recovery after revisional surgery is quite similar to breast augmentation itself. So the surgery itself on average take about a couple hours to do. I do like to put drains in for revisional surgery because most of the time I do remove a lot of the capsules or change the plane. And in that situation, there's a lot of raw surface area to build up fluid. So I do put drains in that situation. It can be done as a day surgery, and so you can go home the same day with the drains. So I do recommend, obviously, you still can move your arms after your surgery gently, and I do recommend to do a little bit of gentle walking for the first day or two. And in terms of anything in general, anything that increase your heart rate, I would recommend try not to do too much for the first 2 weeks. After 2 weeks, you will be able to do a little bit more longer walk. So if you are in an office space kind of work, then you probably should be able to go back to work. However, if your work is a bit more physical, use a lot of your arms and lifting heavy thing, then I would recommend at least 4 to 6 weeks before you can go back to work. Weightlifting or lifting heavy thing in general, I would recommend 6 weeks after surgery before we gradually get into it. So my emphasis is I always believe that, obviously surgery is important, but recovery phase is also important as well. So no matter how gentle and how careful I am as a surgeon, your body still needs to recover from the surgery. So the less complications, the better the long-term outcome. So it is important that we take our recovery phase very seriously. And then the second part of the question is, if I reduce the size of the implant, is it possible, and whether we need to do a lift or not? So then this also depends on your body frame and also what size implants that you have at the moment, and how much that we are downsizing to. So when I size anyone's implants, I always want to look at everyone's proportion and their dimension as well. So when we reduce the implants, we also want to reduce the implant so that it still fit your frame nicely. So if it's a a sizable reduction, we want to make sure that we limit the existing pocket so that the implant doesn't move around in the pocket. And in some situation, when we downsize it, obviously you could lose a little bit more fullness up the top here. And if the breast already a little bit saggy, if we downsize the implant, so sometimes you do need a lift to improve the appearance of it. But at the end of the day, whether we need to do a lift, it depends on whether you'll be happy with the shape of your breast and the location of the nipple after the implant size change surgery. So the other question that I have here is what en bloc all about, and is it necessary? And some people say it's an absolute necessity, and others say it doesn't really matter. So I don't understand why you won't do it if you're removing implants, so that you really are removing everything, and or am I totally wrong with what I'm thinking? So it is a really good question in terms of, en bloc removal, because at the moment it's quite topical of removing implants around the breast, in removing all the scar around the breast implants. En bloc means that we remove all the capsules in continuity with the implants itself. So obviously, whether we remove the implant en bloc with the capsules, it depends on what's the indication for it. So when we remove all the scar tissue, obviously it needs more time to do the surgery, so you'll be under anesthetic a little bit longer, and also recovery is a bit longer, and there could also be more collateral damage if we do more surgery. Because as you can imagine, if the implant is under the muscle, it will be sitting on top of your ribs and under your muscle. So if we go in and try to remove everything, so sometimes you could cause more muscle damage. And also, we would want to do en bloc surgery, the scar that we need to go in, the opening would be a little bit bigger, so the scar will be more. So there's also, risk associated with doing en bloc surgery. So in that situations, if there's no benefits, for example, if the capsule around the implants is still quite soft and there's no calcifications, when we remove the implants, then it might not be necessary to do the en bloc removal, because even if we remove the implant, the body will still form scar around where we did the surgery anyway. So it doesn't really give you much benefit. However, in another situation, if the implant's been in for a long time, there's not a lot of calcium deposit around the capsules, and if there's a lot of silicone leakage around the capsule as well, then it'll be good to remove all the capsules so that we can get rid of all the calcification and also the silicone around the capsule inside as well. And then obviously there's a small group of ladies do believe that the silicone implants cause some illnesses, what we call breast implant illness. So a lot of ladies do think that after having implant surgery, they get arthritis, they become more lethargic, they have rashes, they feel quite itchy, but it's a small proportion of people. Unfortunately, at this to date, there's no medical scientific proof that this illness exists, but I have looked after lady in these situations where I remove all the scar tissue and remove the implant for this small group of lady, and they do get better after this explantation surgery with en bloc removal of implant and the capsule. So in these situations, I would try my best to do everything that we could to remove all the scar possible for this group of lady as well. So I do have some photo of en bloc removal. Let me just show you. So this is the scar around a silicone implant that was removed in one entirety on both sides. And so as you can see, we can remove all the scar tissue if we need to, but I always think about whether there's any benefit and also the risk involved as well. So any other questions so far that come in, Lisa? In the meantime?
If there is a rupture, is this harmful to me? Is silicone harmful to the body?
Yeah, so it is certainly is an important question, because as we mentioned, silicone or any implants, they don't last forever. So at some stage, the implant will lose integrity and the silicone can leak out of the implant. The good thing is the modern implant, the silicone gel, they are quite cohesive. Even if there's rupture, they don't leak everywhere. They will stick together like Turkish delight consistency. So to answer your question whether silicone is harmful, it's according to all the medical research at this stage, there's no evidence that suggests that silicone is harmful to the body. But if there's a silicone rupture, the body do like to remove the silicone particle themselves by forming small nodules around any leakage silicone particle. So sometimes you can have a small nodules around the ruptured implants, but they don't cause cancer, and to date there's no evidence to suggest that those silicone can cause arthritis or autoimmune disease. So obviously if the silicone implants have ruptures, I do recommend to replace them or remove them. But there's no urgency to have to do it straight away. So I usually recommend my patients to have that replaced or removed at the time when they can find some time to recover from work with all their work commitment and family commitment as well, and to find time to recover from the replacement or revisional surgery. So any other questions that coming up?
Do the capsules get sent away for testing when you remove them?
So the question is whether the capsule does get sent away. Yes, any tissue that we remove, we do send away for our pathologists to have a look, just to make sure that there's no surprises. But usually they will report it as fibrous tissue, scar tissue, with or without silicone particle in the scar. So I think there's a couple more questions that come in overnight. So one question is, I have a T-drop shape implant and it's rotated. Is it easy to replace the implant to a smooth implant? So I think we talk about replacing T-drop shape implant. So yes, and spherical implant, there's a small chance that it could rotate, because the nature of a T-drop shape implant, they have a firmer gel to creating a T-drop appearance. So the reason for the texturing, so all the T-drop shape implant, they do come in texture, because the texture reduce the risk of rotations with the frictions of the texture. So there's a 15% chance that a T-drop shape implant potentially could rotate. So in that situation, certainly, we could reposition the implants. So if the reason why sometimes the T-drop shape implant rotate is the pocket that create around the T-drop shape implants is too big, because when we do implant surgery, we really want that T-drop shape to fit into the implant pocket very, very firmly and perfectly, so that minimize the chance of rotation. So if the implant pocket is too big, then yes, we do need to reconfigure the internal part of the implant cavity so that we can replace the T-drop shape implant in a better orientation to give you the best look. However, if it keeps happening, then it might be worthwhile to think about replacing a teardrop shape with a round shape implant. With round shape implants, it could still give you quite a natural appearance if we choose the right size implant that fit your frame and is not too big, because with a softer gel round shape implants, when you sit upright, the gel always drops down to the bottom of the implant to creating more like a teardrop shaped look. And the best thing about the round implants is the shape all depends on gravity rather than the implants itself. So no matter whether it's rotate, it's always going to have the teardrop shape looking towards the bottom. And certainly it definitely can be swapped over to a round shape implants to minimize that rotational risk. Yeah, so have you got any other questions so far that come through? So I think we have been going through all these questions pretty speedily. And so while we're waiting for more questions, I could go through some of my patient revisional cases as well, so that we can have a look at what we can do. So let's just go through this first lady. So this lady came to see me to see whether we can help to improve the appearance of her capsular contracture. So she had her breast augmentation surgery 10 years ago somewhere else, and she had her implant put in on top of her muscles, and it was a 225cc high profile round smooth implant, and it was on top of the muscle. So with time, gradually, then she developed capsular contracture. As you can see, because it's on top of the muscle, it does look rather unnatural with the scar around it and the round look. So this implant is quite narrow for her frame. And after also within the 10 years after she had her breast implant, she did have one child. And so after having children, what she wanted is obviously a more of a fuller look up the top, and also to improve the overall appearance of her breast. So what happened is, as you can see, her chest wall frame is quite slim, but she do have a longer chest. So in this situation, I work with the patients, look at what she wants, and decided that I think a teardrop shape implant in her situation will be able to give her a fuller look up the top and still look natural on the side profile. So I remove all her scar capsules associated with the implants and creating a new pocket under her muscles. So I put the implants in under her muscles and replace it with a bigger implant that she will be happy with the fullness in the top part of her breast. So she do like to have more fullness around this area. So as you can see, with the new teardrop shaped silicone implant, she have a better shaped breast, and this is her side profile as well. Still can achieve a more of a natural breast look despite the fact that it's quite a full implant. So let me show you her chest during the operation. As you can see, this implant is quite narrow. So when we choose the implants, it would be nice to take into considerations of the foundation of F1 breast to help to improve the overall look of her breast. As you can see in this situation, I did put a couple drains in on each side of her breast so that we can drain out the excessive fluid that built up.
Question, does breast massage increase the risk of rotation in teardrop shaped implants?
So breast massaging is one of the things that I do recommend my patient do the massaging after surgery. In a way, yes, if it's a T-drop shape implants, so we do recommend our patients not to do too much massaging in that situations. So if it's a round implants, I do ask my patient to do massaging every day if possible. The way that I ask the patient to do that is to press the breast down for 10 seconds, lift the breast up for 10 seconds, push it in for 10 seconds, and push it away for 10 seconds. But for T-drop shape, definitely try to reduce that rotational actions to minimize that, or the rotation of the implant.
And when women have their implants replaced, do they typically stay with the same implant type, or is it common for them to go from teardrop to round or vice versa?
So the question is whether the woman, when they're replacing the implant, will change implant type or size. So it always depends on patient preference. So, and it's important to understand what you want, what sort of look that you want. So usually, my experience is if a patient after they have implant in for a longer time, they usually like to increase the size of the implant. And most people do go with similar type implants. If they are quite happy with our round shape implants in the first place, most likely they do like the round shape afterwards. However, in very small proportion of people, if they thought the round shape make them look more unnatural, then T-drop shape implants could be used to replace them. And vice versa, if they feel that the T-drop shape doesn't give them the upper pole fullness as much as the round implants, then I do then recommend to change it to a round implant with a firmer gel to give them that upper pole fullness. So it very depends on individual preference in terms of type and the size of implant after revisional surgery.
There's one more case.
Yes. So while we're waiting for more questions to come in, and let's have a look at another lady that have revisional surgery. So this lady, she is 28, and she have implants in Thailand in 2013. So she have the textural mantle implants on top of her muscles, but over time she developed capsular contracture and rupture on the right side of her breast. As you can see, the right side become quite tight. So what I did is I removed her implant with her capsules and replace her implants in under the muscle for her to improve the appearance and make it look nicer. And also I did increase the size of her implants so that it come together a little bit closer to give her a nicer cleavage and also improve the upper pole fullness as well. So during the revisional surgery, I have also did a mini tummy tuck for her to tighten up her stomach skin as well. So how are we going with any?
So I think we've answered everyone's questions.
Oh, we're doing really well. Right. So I think what we will do is, let me just show you one more case while we're waiting for more questions. So this lady actually is a patient of mine from the very beginning. So when she was 18, she had her first breast augmentation by myself. And at that time, I used a 295cc implant to create a more natural look for her. So this is her after her initial surgery, as you can see. So fast forward 10 years later, when she's 28 now, so she would like to have more upper pole fullness and have closer cleavage. So what I did is I have changed the size of her implants from the 295cc to a 400cc to achieve that upper pole fullness for her. So at the 10-year mark when we changed her implants, her implant was still intact, but obviously after a few years later, she do want a different look compared with what she wanted 10 years ago. So this is her after we replace her implant with a 400cc implant. Yeah, so it's been an hour so far, and have we got any more questions so far? So if there's no more questions so far, I might wrap this up tonight. And thank you everyone for coming in to join me for this Facebook Live event. And I'm heading to New Orleans tomorrow to attend the American Society of Plastic Surgeons meeting. So hopefully we'll keep you updated on Instagram about what the latest in plastic surgery. So if you're not following up at this stage on Instagram or Facebook, please join us at AR Plastic Surgery to check out my patient story and also our staff story as well. And if you do want any more information about any surgery, please feel free to contact my lovely patient coordinator Lawrence and Leah so that they can help you along with your journey. So thank you so much for coming tonight, and thank you Trish and Christy one more time to invite me for this Facebook Live event. And I hope you all have a good night.